Hello, my name is RJ. This is Lindsay. This is Taylor. We go to school here at Texas Lutheran University. We're in our medical terminology class, and this is our group. Today we'll be talking about geriatric diseases and disorders.
So just some basic anatomy and physiology of the geriatric disorders. In your skeletal system, your joints will have less synovial fluid, which can make osteoarthritis occur. In your muscular system, your muscle mass is lost, which is muscular atrophy. In the nervous system, your memory begins to decline, specifically your short-term memory. In the cardiovascular system, your heart walls get thinner. In the urinary system, incontinence occurs, which is your inability to hold your urine or feces. In the immune system, your immune functions begin to decline. And then in the integumentary system, that changes around your 40s, and your hair becomes thinner, and then your skin becomes paper thin.
And here are a few appropriate terminologies. We have dementia, overall term for diseases characterized by decline in memory. We have Alzheimer's disease, most common form of dementia. And we also have a Lewy body, abnormal cell in the brain, and this is also a form of dementia. We have a picture up here. Very nice picture found by V. Taylor. And now we have Parkinson's disease, another cause of dementia. Vascular dementia arises from strokes or bleeding into the brain. We have incontinence, inability to prevent discharge of urine and feces, instability, difficulty in balance, and lastly, sarcopenia, loss of muscle mass. We also have another picture here with a normal muscle mass and an atrophied muscle.
And so here is our word construction and breakdown. Our first word that we have is geriatrics, which is just a terminology for old age. We also have cognition, which is just the process of thinking. We also have cognitive, which is the quality of thinking. We also have hallucination listed on here, which is just the process of imaginations. We also have incontinence, which is also what RJ and Taylor first described, which is the inability to hold your urine and your feces. We also have listed visuospatial, which is just pertaining to vision and space.
And here are a few of our abbreviations. We have COPD, chronic obstructive pulmonary disease. It's also the leading cause of death. AD, Alzheimer's disease, a slowly progressive dementia. We have DLB, dementia with Lewy bodies. And lastly, we have FTLD, frontal temporal lobar degeneration.
And then just picking up where RJ left off, we have RT, which is reminiscence therapy. We have PDAs, which is your personal digital assistants. We have SPECT, which is your single photon emission computerized tomography. And then we have our PET, which is our positron emission tomography.
And then here we also have some pictures. So at the top, you'll see this is a dementia patient that is getting therapy. So he would probably use reminiscence therapy or maybe some personal digital assistance to kind of try and jog his memory. We also have just a COPD, so you can see the damaged alveoli there. That's an example of the chronic obstructive pulmonary disease. And like RJ said, that is the leading cause of death in older people. And then at the bottom here, we have a PET scan. This is the positron emission tomography scan, and that is what it would look like. So this is relevant to healthcare because as a medical professional, it's important to know the common signs and symptoms that come along with age and the disorders of it. And knowing these will also help the medical professional to diagnose and treat the patient. And it also helps the professional explain the disorder or disease to their patient and their family.